Hello, hello. We're going to talk about some of the things that get missed in primary care setting, and when your doctor may not be fully telling you what's going on with your kidneys and why. This happens a lot. You'd be surprised. As a nephrologist, we see all the good, the bad, and the ugly, and we see a lot of patients coming in with late referrals and not being referred appropriately. So we're going to just talk about some of the reasons why. First thing is most primary care providers are super busy. They don't have a lot of time because they have to try to meet their quotas, and they have to see a certain number of patients per day. And sometimes they're just too busy to look at the creatinine or the GFR. I know that sounds bad. I know that sounds horrible, but a lot of patients get referred to nephrology when it's too late or after the point of no return, when their kidney function is irreversible. And that saddens me because it happens too much. And I am really trying to get the word out about appropriate referrals and how to manage chronic kidney disease and how to go from medical knowledge to clinical application, because that's what I'm seeing that we're lacking in the primary care community is people just don't know how to adequately manage these patients like a nephrologist would. Now, I'm Dr. Hall. I'm a board certified nephrologist, hypertension specialist, and we have a free webinar that I would like you to check out with a lot of cases that kind of talk about some of this stuff. The other thing that we look at is most PCPs really do want to do good. They want to do an excellent job. I think they have the heart of a physician to help people. They're altruistic, but sometimes their knowledge base may not be where it should be. And that's a liability because nephrology is one of those things where if you know it, good, you can help a lot of people. If you don't know it, you can hurt a lot of people. So knowing how to recognize the subtleties in nephrology and the subtleties that happen in your patients when you put them on a non-steroidal anti-inflammatory, when you put them on an ACE inhibitor, when you put them on gout medications, that knowledge base is critical. And some doctors just don't know. The other thing I see is a lot of doctors are just old. Some people are grandfathered in. They may not have to take the board exams anymore. They may have to stay quite as up to date on all the newest treatment options. So that's something that we all need to contend with and at least assess and evaluate if the physician or physician assistant or nurse practitioner is elderly, then we need to really see if their knowledge base is where it need to be. And that's why I created this course, to try to teach people the things that they need to know and to help bridge that gap. The other thing is most primary care providers uh, have clinical experience at what they're normally good at. So if you see a lot of diabetes, you're going to be good at diabetes. See a lot of blood pressure, you're going to be good at blood pressure. See a lot of gout, you'll be good at gout. But the problem with nephrology is that it's kind of way down the priority list when it comes to primary care. By definition, primary care is everything. Earache, sore throat, uh, bloody nose, you name it. Ingrown toenail, chest pain, urinary tract infection, trouble, uh, diarrhea, constipation. I mean, it's primary care. And so when patients come to your office and they dump all that on you as a provider, it's kind of like, man, I've dealt with the sore throat. I've dealt with the constipation. I've dealt with the UTI. I dealt with the sexually transmitted infection, STI. You know, and sometimes it's really hard to try to manage all those medical problems because it's so many, but they're also complex when the patient has diabetes, blood pressure, and kidney disease, in addition to those other things. So your primary care providers don't quite get enough experience And that's, my heart goes out to them, because they don't necessarily have the full measure of or luxury of doing a nephrology fellowship. And so I want to try to teach people how to manage CKD, chronic kidney disease, nephrology related issues in the primary care setting. That's what we do. That's what this YouTube page is about. That's what the class is about. Is we're trying to teach people how to manage all these complicated issues real time, so your patients can reap the benefits of you having knowledge of chronic kidney disease and nephrology. Another thing I see in the primary care setting is referral pattern, referral habits. Many providers, they're referred to who they want to refer to, or they're referred to who's easy. They're referred to who they can get in quicker, or they may refer to their friends. My thoughts on referral is you refer to the person who can manage the patient the best. I have friends who are nephrologists, and sometimes, they don't live here where I live, so it wouldn't be wise for a provider here to refer a patient to that nephrologist, although he's a good nephrologist. So it would be best to think about transportation, convenience, cost, likelihood that your patient is actually going to make that appointment. There's so many factors that go into referring to nephrology, and how long it's going to take to get an appointment. If it's going to be 3 months and the person's GFR is dropping rapidly, that's inappropriate. Primary care providers should pick up the phone and call the doctor, the nephrologist, and say, hey, I need to get this patient in tomorrow. Can you see him this afternoon? I've had a lot of primary doctors, nurse practitioners call me or text me and say, hey, this patient's potassium is 6. This patient's creatinine was 1.5 a month ago. Now it's 3. And I'll tell them, hey, send them to clinic today. I will see them this afternoon. Or if I'm not even in clinic, I'll say, hey, tell them to meet me in clinic tomorrow at 9 o'clock. So there has to be flexibility in the medical world so that you can adequately manage your patients. I notice some people are kind of rigid. We're not in clinic at that time, we're not going to see you. Wait till tomorrow, go to the ER. But I like to try to accommodate my patients. And as a provider, it's your job to accommodate the needs of the people you're serving. Medicine is a service. Medicine is a ministry. It's not a job like other jobs. It's a calling, because we're taking care of people. So please keep that in mind. Always do your absolute best if you're a provider to try to make sure your patient's taken care of. And I just want to pour my heart out today on some of these issues, because it happens a lot. Patients get the short end of the stick. Patients don't get the high quality care that they need because of some of these issues we talked about. Primary doctors too busy, lack of knowledge, they're old and just don't know, their clinical experience is not where it should be, or their referral habits and referral patterns are not up to date and relevant to what's happening with your patient. So if you're a provider, please take this YouTube video to heart. If you're a patient, please talk to your provider about your kidney function, your GFR, your creatinine, to make sure that somebody's looking at it and somebody's making the necessary referrals so that you won't end up on dialysis. All right. Thank you for tuning in. Goodbye. It's Dr. Hall. Check out our video below in our free webinar.